If you are trans, non-binary, or gender diverse, you may not have seen health information that reflects your experience. This video will help you know what to do if you find a symptom you are worried about. Most symptoms are found through self-checking. If you are taking feminizing hormones, during the first couple of years, you may see changes to your breast shape. It's important to check regularly and learn what normal involves for you. Some pain and tenderness with breast growth is to be expected, but unusual textural skin changes and constant pain are not. Always make a GP appointment if you have any of the following symptoms. Discharge or liquid that comes from the nipple without squeezing. New, unusual lumps or an area that feels thicker than the rest. Puckering or dimpling of the skin. It may look like an orange peel. A sudden, persistent, or unexplained change in size or shape. Unexplained pain or soreness that doesn't go away with your period, if you have them. The nipple inverts or points in a different direction to how it usually sits. A lump, swelling, or thickening in your upper chest or armpit area. Redness, a rash, or crusting of the nipple or the surrounding skin. Your breast cancer risk does reduce with top surgery, but it doesn't go away. As the overall amount of breast tissue reduces, there is less tissue that can become cancerous. But top surgery doesn't remove all your lymph nodes. Cisgender men can get breast cancer too. There is always a risk. Family history and environmental factors can increase this, so it's important to look out for any significant changes, whatever your gender identity and medical history. Alex had seen awareness-raising adverts, remembered a relative telling him their experiences finding a lump. It always seemed like something that happened to other people. But there it is, just below the surface of the skin, a lump that doesn't feel quite right. It feels hard in a way that muscle and skin don't. He thought after top surgery that checking his chest wasn't really needed. He calls a close friend and they encourage him to make a GP appointment. His GP performs an initial exam and refers him to the breast imaging unit for further tests. Your GP will decide if your symptom requires a referral to the Symptomatic breast clinic. Anyone can avail of this service, even if you've had top surgery or a mastectomy. Before the appointment, you might be feeling anxious about how you will be met at the clinic and what the results will be. You can bring a friend or family member to the appointment for company and support. We advise you to wear loose clothing to the appointment, and if you bind, ensure you can easily remove it for scans. If your gender marker with the GP doesn't match your gender identity, call the clinic and give your name and pronouns ahead of time, or you can give these details to the receptionist at your appointment. It's helpful to arrive 10 to 15 minutes early to leave time for this conversation and avoid delays. The breast imaging at Antrim Area Hospital offers a one-stop service, which means you will be able to get multiple tests on the day to enable the team to try and give a diagnosis. This means you will be spending a while in hospital, usually a half day in total. The tests you will have may include a mammogram, ultrasound, fine needle aspiration or biopsy, depending on the assessment of the breast surgeon. If you have had top surgery, you might not have enough breast tissue for a mammogram. Alex's first appointment is with the breast surgeon, and it will be the breast surgeon who decides if there is enough tissue for a mammogram, and what tests will be best to help identify the cause of the symptom you are referred for. This is a good opportunity to talk about your gender history and let the medical team know if there are any areas of discomfort or dysphoria for you. The type of tests you may have can vary depending on your symptoms and what needs further investigating. If there is enough breast tissue to perform a mammogram, the radiographer will take you to your room to change. You will need to take off your clothes to the waist. The radiographer will need to touch your chest in order to position your breasts for the mammogram. The breast or chest is compressed between two plastic plates. Let the staff know if people touching your breasts or chest is a dysphoria trigger for you, so they can work with you to get the clearest images possible. Diagnostic mammograms usually mean 2 images are taken of each breast. 4 in total for a female, and 2 images of each breast if male or have minimal breast tissue. An image of each breast is taken for comparison. It can be a bit uncomfortable but not painful. This is only temporary. The radiographer will talk you through the process in full, and you can speak to them beforehand about any adjustments you might need, as well as any previous breast or chest pain. They are trained to make you feel comfortable, and you can stop at any time. You may be called multiple times for a mammogram during your time at the breast imaging unit. This is normal. It may be that further angles or images are needed. Overall, it is a quick process and should take no more than a few minutes to perform. Nearly all symptomatic patients will begin by having a mammogram, one oblique view on each breast for males with limited breast tissue, unless they are under 40 years of age. Then they would go straight for an ultrasound. Most younger people presenting with symptoms may be recommended an ultrasound because the tissue of their breasts or chest can be denser. If either the mammogram or ultrasound come back with something that needs further investigation, a biopsy might be necessary. An ultrasound scan uses sound waves to create a picture of the tissue beneath the probe and allows a closer look at a focused area. Alex is asked to lie down on a table and undress enough for the radiographer to assess his chest. Some clear, slippery gel is placed over the area of the chest where the lump is suspected. Paper towels can be used to wipe off any excess gel at the end of the procedure. The radiologist might ask you to move slightly to get different angles or images, and stop to make notes from the screen. When they have all images they need, Alex is able to get dressed again and go back to the waiting area. The breast radiologist reviews the images and decides whether a biopsy is needed. For Alex, there is an area on the scan that needs further investigation, and the breast radiologist decides that a core biopsy is his next procedure. Another option you might be given besides a core biopsy is fine needle aspiration. This is a smaller form of biopsy, and using a really fine needle to obtain some cell samples from the lump or aspirate fluid from a cystic area of concern. You will be asked to lie down and remove clothing around the area of your chest that needs looking at. No anesthetic is required for fine needle aspirations. You feel a small scratch initially and a little pressure for a few minutes. The word biopsy can sound scary, but it's not as invasive as you might think, and is an excellent diagnostic tool that once completed will give you the results you need to know. You will be given some anesthetic, which is injected into the skin surface and deep into the area the biopsy needle will be inserted into. The anesthetic needle will hurt a bit going in, like any injection, but it numbs the area where the biopsy needle will be placed. A biopsy needle may make a loud noise as it samples the tissue. A biopsy needle is designed to withdraw a small portion of tissue from the lump itself. The whole thing will feel a little uncomfortable, and you will be a bit sore. You may experience some bruising at the site afterwards, but it can be performed quickly as the team know the exact area they are looking at. Once the tissue sample is collected, Alex can get dressed and return home. The breast imaging staff will provide you with some aftercare advice for the biopsy site and information regarding when and how you will get the results. At the end of your appointment, you will have a final check-in with the consultant or breast care nurse. This is an opportunity to ask any additional questions and for the team to offer you more support and signposting. It is okay to drive yourself home after a biopsy, as the anesthetic is localized, but you might be a bit uncomfortable. Regarding results, any biopsy has to be sent off to the lab for processing, and it can take time to perform all the tests needed on the extracted tissue. A breast care nurse will be in touch with you when your results are ready. If you do receive a diagnosis of cancer, Macmillan Cancer Support is here throughout your journey. If you feel you would benefit from LGBTQIA+ cancer support, this can be provided by Cancer Champions team at Rainbow Project, Macmillan Cancer Support, Outpatients, and UCATS. For more trans and non-binary breast and chest screening videos and information, click on the link in the comment section.